Good afternoon and welcome to part 2 of the two-part CEHN webinar series, Partnering to Protect Children's Health Lead Service Line Replacement. Part 1 of the webinar series provided an overview of the health impacts of lead, drinking water sources, and introduced the Lead Service Line Collaborative. For those who missed the first webinar, the Collaborative is a diverse group of national public health, water utility, environmental, labor, consumer, housing, and state and local governmental organizations organized around the goal to help communities develop and implement voluntary replacement programs to fully replace lead service lines. A recording of part 1 of the webinar series can be found on the Collaborative's website at the link below. Part 2 will be recorded and posted online as well. Today's webinar is intended to be more action-oriented, providing information and examples to help communities implement replacement programs. I'd now like to introduce Dr. Elizabeth Neary, who will be our moderator and first speaker today. Dr. Neary is a clinical adjunct assistant professor of pediatrics at the University of Wisconsin School of Medicine and Public Health and a member of the American Academy of Pediatrics Council on Environmental Health. She's on the executive committee of the Wisconsin Environmental Health Network, a working group of the Wisconsin chapter of Physicians for Social Responsibility. After practicing primary care pediatrics for over 15 years, she now devotes her time to teaching and advocacy. She recently provided expert testimony to the Wisconsin legislature on the health effects of lead in support of a bill to replace lead service lines. Welcome, Dr. Neary.
Thank you, Lindsay. Good morning and good afternoon to those on the West Coast. So in the last webinar, Dr. Bellinger, Dr. Spanier, and Thomas Neltner from the EDF gave an excellent presentation detailing the health effects of lead as well as the main sources of lead in drinking water. And just as a quick summary, I'm going to talk about the main sources of lead poisoning still include paint, which is chips and dust that can occur in the home or in the soil, water, and even food. Less common sources do include imported ceramics, candy, spices, traditional medications, and even exposure due to parents' occupation, hobbies, and even cosmetics. But my main focus today will be on the water. So let me just summarize with the next slide some of the key points that were already covered. So the first one is there is no safe level of lead. And we know now from increasing levels of research that even at very, very low levels of lead, that there is damage to the developing human brain, and the most vulnerable continue to be the fetus, the infant, and the very young child. The second point is that the formula-fed infants are truly at the highest risk, and that's the group of children from 0 to 6 months, because formula-fed children, their entire diet consists of the liquid, which is the formula made with that contaminated water. And when you consider that that's such a high dose and a high amount to this very small child, it's a very high dose in relationship to the size. The other point is that lead in liquid is actually more readily absorbed by children and infants. The infant also is in a rapid state of growth and development, and especially the most vulnerable part being the brain. The third point I want to make is that there's insufficient data to truly assess the magnitude of this problem, and I'll address that in the third slide. Number 4, that the EPA level of 15 parts per billion is not health-based. It's based on corrosion of pipes. And again, Tom Neltner did an excellent job in the first webinar going into the details on that. We know that formula-fed infants can be poisoned by lead even when the water meets the EPA levels of 15 parts per billion. The next point is that the lead service lines truly are the primary source of lead in drinking water, and the best estimates are that it contributes as much as 70%. And the next point I want to make is that taking into account what we know about the science and who's most affected, Milwaukee has done an excellent job in the sense that they are prioritizing replacing the lead service lines first and foremost to the 300 daycare centers in their town. They also need to replace 70,000, but the important point is that they are prioritizing it. Next slide. This slide just demonstrates in the state of Wisconsin where we know the lead service lines are. And as you can see, Milwaukee, with their 70,000 lead service lines, really has the biggest problem in our state. And many states can have a similar graph that you can look at. And this is courtesy of the Wisconsin Center for Investigative Journalism. Next slide. So my point that I was making before, that we have insufficient data on the number of infants who are truly exposed to the contaminated water, is shown in this slide. So the point is we actually don't test infants for lead poisoning. Children are typically tested at ages 1 and 2 because that was based on lead-based paint. In fact, children on Medicaid, it's mandated that they are tested at age 1 and 2. So it's unusual for us to test infants. So we really don't have a good handle on the magnitude of the issue. So in Wisconsin, for example, from 0 to 6 months, we only tested 1,200 infants. And the reason we tested those infants was mainly because they had a sibling that was lead poisoned, and that triggered the whole family to be tested. But as far as 1-year-olds, we tested 40,000, and 2-year-olds, we tested 21,000. Next slide. And then here's my action point. So in Wisconsin right now, we have 2 bills, a Senate bill and an Assembly bill, and these bills will hopefully allow municipal water public utilities on a local level to provide financial assistance to replace the entire lead service line. The good thing about it, it's a bipartisan bill, and it has broad support. And what I did here is walked you through how to get to the site. And the reason that I did that is I think it's really important, and you may find it useful, to look at the various groups that spoke in support of the bill. So it was the League of Wisconsin Municipalities, we had the Wisconsin Rural Water Association, the City of Milwaukee, the University of Wisconsin, but we also had some groups that you might not think of when you're trying to build consensus. For example, the Wisconsin Realtors Association spoke in favor of it. I would have never thought to ask them to come to the table, but they brought up an excellent point that if the lead service lines in a community are not changed over, it will be more difficult for them to sell homes in that community because people will say, well, I don't want to buy a home that my child could be exposed to lead. And I think with the FLINT crisis, people are very aware of lead in water now. So what I did is I walked you through how to get to the hearing materials, and hopefully you can use that as a reference because it's very good to read not only what the argument's in favor of, but there was one group that actually is in opposition, and it's always good to see what the opposition's arguments are. And the last thing is a YouTube video that it's called Little Things Matter. And I used that during my testimony. If you go to minute 3 on there, there's a good section on lead, and it shows exactly how 3 or 4 points of an IQ in a population make a big difference. And the doctor who did that video did such an excellent job. I thought it was worthwhile to bring that to the testimony. So now let's go forward here and introduce our next 2 speakers. So first, Queen Zakiya Shabazz is a community advocate. She's an author, an educator, a lecturer, a wife, and a mother. And in 1996, she discovered that her son, Zaki, had been poisoned by lead. This discovery prompted her to establish the Virginia chapter of United Parents Against Lead and to write a book about her family's struggles with lead poisoning entitled A Child is a Terrible Thing to Waste. She is a member of the advisory board of the Senate Joint Subcommittee studying lead poisoning prevention, a member of the Virginia Environmental Justice Collaborative, and the Lead Service Line Collaborative. She is a passionate advocate for children and is dedicated to the eradication of lead poisoning. Welcome, Queen Zakiya.
Thank you very much. Good afternoon, everyone. And I'd like to thank the Children's Environmental Health Network and the Environmental Defense Fund for inviting the Voice of Parents to participate in this webinar. We're going to start on a high note with some good news. We found out yesterday that the City of Richmond has been awarded a $2.7 million grant towards lead hazard reduction and healthy homes interventions. And as UPAL will be a partner on the grant, we will certainly be promoting lead service line replacements, full lead service line replacements, because that is a part of the Green and Healthy Homes initiative that the grant was funded under. Next slide, please. This is a little bit of information on UPAL, our background. Our mission is to end the continuing threat of lead poisoning and environmental hazards through advocacy, education, intervention, and resource referral. We are the premier parents organization advocating for parents, families of lead-poisoned children and against lead and environmental hazards. We were founded by parents of lead-poisoned children, and our motto is, "A child is a terrible thing to waste." Next slide, please. We want to pay tribute and homage to those who came before us, those upon whose shoulders I stand. The following slides will show lead poisoning prevention advocates and or warriors for environmental and social justice. We have Ivory Perry, Marcy Jackson, and Dr. Vivian Cross, and I'm not going to go into all of the personal details of how each one of these people have touched my life, but they actually sparked me on to becoming the person I am today, because when my son was poisoned, it was not my intention to even start an organization or to be as active as I have become over the past 21 years. This April, United Parents Against Lead celebrated our 21st anniversary. And so these are names that I feel that if you're not familiar with, that you should know. You should know Ivory Perry, Marcy Jackson, Dr. Vivian Cross. Marcy founded Parents Against Lead after 2 of her children were poisoned, and one while Marcy was pregnant with her, so she was poisoned in vitro. And Marcy prompted me to begin United Parents Against Lead, and we joined forces, and she passed the torch on to me when she passed away in 2002, as I hope to one day pass the torch, or really hope to not have to pass it, because we will have defeated lead poison, and none of our children will be getting poisoned. Next slide, please. These are more warriors that touched my life and opened the door and gave me the courage to found United Parents Against Lead and be that voice for parents and for our children. Damu Smith, Dennis Livingston, and Ralph Scott. So I poured libations to all of them this morning and asked that their spirits be present with us today, to know that we are continuing the fight, and as I said, one day hopefully we will be able to hold up the victory and say that we've won the battle against childhood lead poisoning. But until then, we continue to fight. Next slide, please. So the incidents in Flint, Michigan created a firestorm. Anytime there's upwards of 9,000 children and their families poisoned, that's definitely a health crisis, an environmental crisis. And as far as I'm concerned, it should still be in the news. I think when incidents of such magnitude like a Katrina or like a Flint happen, I think that the news media goes away much too soon, and this should be on our minds every day, because that would make the work of the lead service line replacement collaborative much more easier. We wouldn't have to sell it as much, because all of us drink water. All of us need water to survive, and we have the right to safe drinking water. Next slide, please. Faces like young Cynthia Smith should, as I said, be in our minds every day when we see the children and how they've suffered from lead poisoning, first in the paint. 21 years ago, when UPAL got started, our biggest foe was lead-based paint. But as Dr. Nearly said, it's always been in our water, and corroded pipes have always been a way for it to leach into the water. But that was not held up or really addressed that much until Flint happened. So the connection I like to point out between Flint, Michigan, and Virginia is that first Dr. Mark Edwards An environmental engineering professor from Virginia Tech was the one who broke the story on FLINT, as well as he had pointed out years before the hazards of the drinking water in schools and homes in Washington, D.C. So, in the photo, this photo that you see of Cynthia Smith was taken by Regina Boone, whose family started a newspaper here, and she did not know that it would make the cover of Time when she started that newspaper. She's now with the Detroit Free Press, so they got the credit for it and not Virginia, but Regina Boone is one of our own. She took that photo of Cynthia Smith. Next slide, please. Dr. Frances Cress Welsing said that children are the only future of any people. And if we believe that to be true, what are we prepared to do to protect and ensure our future? Next slide. These are children of United Parents Against Lead. Starting on the right with Zaki, that is my son, who was poisoned in 1996 with an elevated blood lead level of 30. In the middle is Sergio, who was poisoned in 1991, elevated blood lead level of 60. And Michael, who was poisoned in 2015 in Petersburg, Virginia, with an elevated blood lead level of 89. And this continues to bother me when we see the progression of the levels as the years go on. And if you would look at Michael, I have that he's a victim of childrenism, which is a term that was coined by United Parents Against Lead. We actually filed a lawsuit against the city of Petersburg because they had been awarded a $1.1 million HUD grant that they ended up getting rescinded by HUD because there was no activity. So childrenism, as UPAL defines it, is a systematic discrimination against children, gross negligence, gross dereliction of one's responsibility to children, practical opposition to the safety and wellness of children, willful disregard and failure to protect children in your charge. That's what we charged the city of Petersburg with. The case was dismissed because I am not an attorney. So if there are any attorneys listening on, we still have the opportunity to bring the case back. We would very much like to pursue this matter on behalf of lead-poisoned children, because we believe that Michael would not have been poisoned if the city of Petersburg had done what they were supposed to do and implement the grant. Next slide, please. So lead poison is the #1 environmental health threat to young children. It's a heavy metal that has absolutely no benefits to the human body. Next slide. Why is lead service line replacement important to us? As was mentioned earlier, there are absolutely no safe levels of lead. Prenatal exposure and exposure to young children is particularly dangerous as their minds are developing. What can we all do? We can work with drinking water professionals, public health professionals to consider a lead service line replacement initiative and help build consensus for the initiative by ensuring the replacement process engages all voices in the community with inclusive messaging so that everyone has the opportunity to benefit from the lead service line replacements. We can also advance policies that support local initiatives, including equitable funding options. Next slide. So recently I did a presentation at the Virginia State University, and it included this slide talking about the Chesapeake Bay watershed and the more than 18 million people that live in the watershed. As you can see, it encompasses 64,000 square miles in parts of the 6 states, including Washington, the District of Columbia, Delaware, Maryland, New York, Pennsylvania, Virginia, and West Virginia, and the entire District of Columbia. So listed there are some water pollutants, including lead, mercury, PCPs, sewage, farm manure, fluoride, and atrazine, which is a herbicide. Some of the solutions are certainly full lead service line replacements. Some cities, including Petersburg, Virginia, have issued boil water alerts. We can train and certify work crews, which will lead to job creation for community residents. We must always increase public education and awareness of potable water. And we must make sure we join political will with community voices. These funding sources that you will see here are all sources that UPAL have received funding from over the years. In 2004, we received a $2 million grant from HUD, Housing and Urban Development. And in the city of Petersburg and Richmond, we tested over 150 homes. We remediated 100 of those homes of lead hazards. Cameron Foundation is a local foundation. We've recently received funding from the Environmental Defense Fund, yay, and also an Environment Protection Agency in the past. And we've received funding from Falls of the James, which is a division of the Sierra Club. And another foundation, the John Randolph Foundation, is a local one based in Hopewell, Virginia, and also local health departments. So that's just to show that there are resources that will support our efforts in making sure that the lead service lines are replaced. Next slide, please. Poison water, there is a link for a documentary that was recently aired on PBS, which details the Flint water crisis and the sheroes and heroes who fought to raise public awareness of what was actually happening in Flint, although the residents have been talking about it for some time before it actually hit the widespread public. And this documentary does a great job in revealing exactly why the water got contaminated in Flint, Michigan. Next slide, please. So my teacher, the Most Honorable Elijah Muhammad, used to often say, don't criticize a dirty glass, but put a clean glass next to it. So looking at those and knowing that we all have the right to safe drinking water, which one of those would you choose? Which one of those glasses of water would you choose? And that's how the water in Flint, Michigan was looking, the murky glass. That's exactly how the water in Flint was looking. And this is water that you have to bathe in, cook in, wash your clothes in, drink. Which glass would you choose? Next slide, please. So, UPAL, United Parents Against Lead, we're based in Richmond, Virginia. And part of the funding that we're receiving from the Environmental Defense Fund as well as from the Falls of the James will be used for lead service line replacement and also educating the community on the importance of full lead service line replacement. So in Richmond, Virginia, there are 14,000 lead service lines that bring water into our homes. According to our water utility company, since 1995, the city of Richmond has been proactive in voluntarily replacing those lead service lines. I was told that it takes one day for full replacement, working with a crew of 5. And additional funding will be able to add more crews. And UPAL would like to play a role in actually training those work crews. The City of Richmond has applied for state funds to assist consumers or homeowners so that the homeowner side of the service lines will also be replaced, which will ensure full replacement. And I was actually told at a city council meeting last Monday that state funding had been approved for the city of Richmond to work with lead service line replacement. So funding for the state of Virginia, our health department's Office of Drinking Water recently set up a lead service line replacement rebate program with a focus on providing funding to low-income communities. The program will provides $500,000 per year, which includes reimbursement to the homeowner up to $5,000 per line, and to the water utility up to $500 per line. Virginia's Department of Health hopes to replace 125 lead service lines per year through this funding. And so again, we have in Richmond alone 14,000. And in Virginia, our General Assembly has mandated Senate Bill 1359 that calls for mandatory water testing in public schools, which is also very right on time with the funding that we'll receive from the Falls of the James, because we're going to actually use a pilot to test the water in 4 elementary schools, and hopefully those will be some of the first schools that get lead service lines replaced. And next slide, please. United Parents Against Lead also supported Senate Bill 1587, which is in Texas, that was introduced by Senator Sylvia Garcia in Texas. Senate Bill 1587 seeks to protect Texas children from lead poisoning by testing drinking water at public and private schools and child care facilities, and fixing lead-contaminated pipes and outlets. So that is a plus as we see more states and more political will to do the right thing. So UPAL, we are stressing the urgency and importance of lead service line replacement, initiating community conversations. We've spoken to our school boards, we've spoken to city council, and we plan to do that at some of the surrounding counties of Virginia. We're assisting with making maps of lead service lines publicly available. We will be working along with students at Virginia State University to make sure we get the mapping done correctly and timely. We will continue to meet with drinking water utilities to promote the replacement, and hopefully we can get them all on board, like the city of Richmond, to just voluntarily replace, because we don't want to wait until there's a FLINT. We know that all of our infrastructure of the older cities are just like those in Flint, Michigan. And as Mr. Mark Edwards of Virginia Tech stated, that there are over 5 million lead pipes in the United States, over 5 million. And most of those are 40 years old. So they're all at the point where they're starting to corrode and break down, that will allow them to allow lead and other contaminants into our water. And we'll be continue to address public or elected officials and prompting them to get on board with full lead service line replacement. We spoke about the funding of the James, funding from the Environmental Defense Fund, where we will be improving Virginia's disclosure requirements. It saddened me to know that Virginia had gotten a grade of an F, actually failed in regards to our health policy, in regards to water and waterborne illnesses. So definitely want to help this state to, come out of that F rating to an A rating, and we will help by making sure that we get the maps done of the lead service lines, where they are and in what order they're going to be. replaced. And we also always receive private donations. We'll be hosting a lead service line replacement awareness event in October. Next slide, please. That is my son. He's now actually 23 years old, but when this was taken, he was 22. This was actually at the Children's Environmental Health Network. We were awarded as the community advocates. We received an award, United Parents Against Lead. So that is Zaki. As I said, he's still battling with lead poisoning. You know, its effects, they don't go away. It persists a lifetime. We just try to make the most with the cards that we're dealt. And he has been a warrior in his own right, in trying to do the right things, even though the lead is trying to control him and tell his mind to be impulsive and do other things. It has affected his cognitive ability, and that is why it's so important that we don't continue to allow our children to be poisoned and try to say we'll deal with it after the fact. We have to be more proactive, and if the lead service line replacement is one of the ways that we can make sure that our children don't become poisoned, then I say everyone should get on board to make sure that we have full lead service line replacement. Next slide. That is the book cover, Child is a Terrible Thing to Waste. And I have a sequel coming out as soon as I get time to finish writing it, called Triumphing Over Lead. Because when Zaki was poisoned, our whole family became affected. And it went on to create an organization that has been around for 21 years. So if nothing else, we'd like to serve as an encouragement to those parents that, you're not just a mother or a father, but you have to be that advocate for your children. And your voice is powerful. Use your voice and make the connection with those who can get you the results that you're seeking. And don't settle for no. If someone says no, then go and ask somebody else, but keep on until you get the results that you're seeking. Next slide. And that's my contact information. And feel free to email, call us, and most importantly, lend us your voice. Join on with us to promote lead service line replacement, full lead service line replacements. We need every voice that we can in every city and state that we can until all of those 5 million lead service lines have been fully replaced. And hopefully one day we can say that we have beat lead poisoning. Thank you so much for this opportunity to share with you today. Peace and blessings. And I will turn it back over to our host.
Thank you, Zakia. That's a really powerful presentation, how you took the pain of lead poisoning and turned it into advocacy. You're a great example for people listening on the phone to use their voice. And thank you for emphasizing this whole idea that we need to prevent this. It's not enough to identify it. We need to prevent it. So thank you very much. It was a great presentation.
Thank you.
And now our next speaker will be David LaFrance. David LaFrance is the CEO of the American Waterworks Association, the world's largest and oldest association of water professionals, with 43 sections through North America and more than 50,000 members worldwide. He oversees a staff of 150 in both the United States and in Mumbai, India. LaFrance guides AWWA's extensive scientific, educational, and public policy work to build a better world through better water. Prior to joining AWWA in 2010, he was the CFO for Denver Water, where during his 17-year tenure, he also served as the Utilities Manager of Rate Administration. His professional background include water policy and management experience with the global engineering and consulting firm CEHN, as well as the U.S. Army Corps of Engineers. Welcome, David.
Well, thank you so much for having me. It's a pleasure to be here. and I'm really pleased to be part of this collaborative process. One thing, as I was listening and as I was thinking about this presentation, one thing just seems clear to me, and that is that the power of this collaborative, the coordination that we have, is really having a big impact on changing how water is supplied in the U.S. To all of the homes and the businesses that we or my members try to serve. And I'm proud and that AWWA can be part of this process and part of the solutions. So today what I'd like to do is I'm going to try and cover 5 things. I want to give everyone a little bit of a background about the American Water Works Association, and I will quickly slip into calling it AWWA. The reason I want to provide that background is because everybody does not know who we are, and I think it helps for context. The other thing I want to do, the second thing I want to do, is to provide some background on who it is that provides water in the United States, the drinking water in the United States. Because again, I think that helps provide context for the challenges in front of us with lead service lines and the removal of full lead service lines. So the third thing goes right to that point, which is I want to frame up the magnitude of the lead service line replacement challenge. And the fourth would be to provide some examples of places and solutions that are in process, and they have, for the most part, the processes have really been accelerated because of the type of work being done by the Lead Service Line Collaborative. And finally, I'll sum up with how AWWA is trying to help accelerate these solutions. So if we can go to the next slide. I just wanted to introduce to you the American Water Works Association. The introduction of me did most of that, but we were founded in 1881. And since our inception, we've been a leading group, a leading organization focused on making sure drinking water is safe to drink. We are a nonprofit organization. We're organized as a 501c3, which makes us a technical and education organization. And so we focus on that. We focus on technical aspects and educating water utilities and those who support water utilities. We have over 50,000 members, and over 4,000 of those members are water utilities, serving most of the population in the U.S. We also have what we call sections, which are local groups, local chapters, if you will, of the American Water Works Association. We have those in U.S., Canada, and Mexico, and we do have a small emerging one in India. I just wanted to draw everyone's attention to the slide. On the left-hand side, we've got our mission stated. And the key word, I think, for this challenge is that AWWA positions itself to provide solutions that will help everyone, help our members effectively manage water. But really, we aren't the researchers. We do some, but we are not really positioned as the researchers, but we're positioned as the people who put the solutions in place. And that's sort of our unique power, if you will, as it relates to the water community. And we do that for the core principles that I have listed on the right-hand side of this slide. And there's at least 2 in here that I really want to draw everyone's attention to. We do focus on public health and how water supplies can help promote public health. And as it relates to lead service lines, we focus on sharing best management practices. So if we can go to the next slide, I'll give an example of that on the best management practices. As it relates to solutions and best management practices, the American Water Works Association provides these things called policy guidelines to our members. And this is something that our members can reference when they're looking for sort of an industry position on a topic. And we also provide things that are called standards. We provide manuals of practice, training manuals, all of those sorts of educational things. But we have 36 policy statements, and we reserve those policy statements for important topics like lead service lines and replacing lead service lines. So they really represent core tenets of what AWWA stands for, and they're designed to help our members find solutions. So this past year, we adopted in January of 2017, our board adopted this policy statement, which I'm just showing you pieces of it, the key elements of it. It recognizes that lead service lines are impactful of public health, and the removal of them is a benefit to public health, that the removal should be for the entire lead service line because there are oftentimes practices to do portions of lead service lines, that it will take time. This is something that is of a magnitude in terms of the number of lead service lines that it cannot be a quick fix, and it has to be an approach. We have to take approaches that we are careful as we do them, so it will take time. As the collaborative is proving, community-based approaches are really the best way because there isn't one organization that can provide all of the solutions to this. As part of the solutions and as part of the community-based approaches, outreach to property owners and to the community at large, I think, is critical. And so the policy stresses that. And then finally, optimizing corrosion control, which is a treatment process at the water treatment plant that helps protect people from, or residents from, lead in their water, is important while we go through the process of fixing this problem and removing lead service lines. So if we can move to the next slide, what I'd like to do is start framing up who it is that is providing water in the U.S. So what the pie chart is trying to show is that there's sort of three categories of what's called a public water system. But for the most part, when we think of who's providing water to us, the water utilities, what we're thinking about is that group in the orange. They represent the community water systems. There's about 34% of all of the water systems are in this category. So it's approximately about 51,000 water utilities, and they are the ones who are for the most part providing water service in the U.S. By definition, they serve the same people. That has to be over 25 people year-round. And the other two categories, they don't do that. They have transient populations that move in and out, or they serve less than 25 people. And so they are not the ones that we're focused on as it relates to lead service lines, largely because they don't have distribution systems that would then have lead service lines. So my comments will be focusing on this 51,000 community water systems because they have lead service lines and because they serve most of the population. So if we can go to the next slide, I also want to frame up a little bit about the 51,000 community water systems because they too are not all the same. In here, this pie chart is showing you the breakdown of the very large water utilities all the way to the very small water utilities. So the very small water utilities are shown in yellow. Then as you get a little bit bigger, but you're still small, you're in blue. And eventually you get to those green, and the green slice and the orange slice, and you see what we would call large or very large water utilities. So the large and the very large water utilities constitute about just 10% of, it's actually a little bit less than 10% of all the community water systems, of the 51,000 water systems I spoke about on the previous slide. But they collectively are serving about 80% of the population. So there's a few water utilities serving most of the U.S. population. At the other extreme, if you take all the yellow and the blue water utilities, those are most of the water utilities. In fact, it's about 80% of them. And they are only serving about 8% of the population. So when you think about the people serving, the water utilities serving us with water every day, there are a few serving the many, and there are many serving a few. And that sort of distribution is important as we think about how do we solve this challenge. So if we can go to the next slide, we'll start talking about how big the challenge actually is. So this graphic is designed around framing up the number of lead service lines that are affecting the U.S. And so while I've got the number and the distribution of the system size in your minds, I thought we'd take a look at how the lead service lines are represented here in the U.S. and how we estimate the number that are out there with challenges for us to solve. While I'm going to share some numbers with you, the bottom line is that these are just estimates. We don't know the exact count. But in 2015, the American Water Works Association, in order to sort of frame up the magnitude of this, we funded a study to determine how big of a challenge it is. How many lead service lines do we want to have removed? Our best estimate came out to be about 6.1 million lead service lines. As we took that estimate and we bracketed it, we came up with estimates somewhere between 5.5 million to 7.1 million, with our best estimate being about 6.1. The U.S. EPA has an estimate that they are continuing to use of about 10 million, so it seems reasonable to use estimates of somewhere between 6 to 10 million lead service lines as an estimate throughout the U.S. That constitutes about, when you use that 6.1 million estimate that AWWA came up with, that constitutes about 86 million households, or about 7% of the population that has potential risks associated with lead service lines. The colors that you see on the graphic show you sort of the intensity of where the number of lead service lines are. So the darker the color, the more lead service lines you'll find in that state. And as you might imagine, the frequency of lead service lines is associated with older buildings, older structures, older homes, and older communities. And so consequently, larger communities oftentimes are the ones where we find a lot of lead service lines. That being said, our estimate is that every state has some vulnerability to lead service lines. There wasn't a state that we didn't estimate would have some. And so even though you see some lighter colored states in there, everyone needs to be vigilant about thinking about where their lead service lines are and how they should remove them. So for example, in the West, Colorado, which is where I live, it's a lighter colored state, but as I'll point out in a little bit, Denver, where I was the CFO, has found that, or they're estimating that they have approximately 60,000 lead service lines in their service area, which they are actively trying to remove. So let's go to the next slide. And I think it's, as we in the collaborative are working at removing the full lead service line, it's kind of important to get a sense of some of the initial challenges about ownership of lead service lines. So this graphic shows a full lead service line. That circle on the far left, which is labeled as water main, is essentially trying to depict a cross-section of a water main that would run down your street. And then from that blue bar that's moving left to right is a service line. So it's basically the pipe that connects your house or your business to the main in the street. And there's really two sections to it. There's one to the left of what's called the curb stop. So basically think of that as the portion under the road, and that's the public portion. And then the portion under the green bar above, which is supposed to depict your grass or your property line, is what's called the private section, the section that's generally owned by the homeowner. And so this dual ownership creates some challenges with how do we go about removing a full lead service line, because that's what we would like to do, is to not remove parts of it, but remove the entire piece, in part because the CDC, as has been mentioned, has clearly stated that the concerns have to do with removing all lead, and that any lead exposure, as we've already said, is bad for public health. And as long as there is lead in contact with drinking water, there's always going to be some risks to all of us who drink water, and especially the most vulnerable populations. So while we have taken some steps to remove lead in other forms, in drinking water, there have also been a few steps, but removing the lead service lines is probably the next largest step and maybe the most meaningful one. In 1986, there was a ban on plumbing with high lead contents, so that was important. In 2012, the available level of lead in plumbing materials was further reduced, and then corrosion control has been focused on for reducing lead in the lead and copper rule in 91, 2000, 2007, and also anticipated in additional updates to the lead and copper rule. So ultimately, our goal is, of course, a future where water doesn't come in contact with lead so that we can all have a safer future. So can we go to the next slide, please? So as I mentioned, AWWA is proud to be part of the Lead Service Line Replacement Collaborative. It's a community-based activity to remove lead service lines. And to solve the problem, it's going to take many, many voices. And that's why I feel that this collaborative is very powerful. There needs to be a broad group who buy into the need for the approaches to replace the lead service lines. And there's, as I mentioned before, there's no one group who can achieve the full lead service line removals by themselves. So for example, individual households, they face cost and logistics barrier problems and challenges. Utilities need the public to understand the health benefits of removing lead service lines, and they need help with funding challenges and political support. Political leaders need a clear understanding of why replacing lead service lines is important, and state and local agencies have their roles to play as well. Public health officials may have one of the strongest and most credible voices on why getting lead out is a priority. And so I just wanted to point out that the public health community can be of great assistance. They can offer the quantitative analysis as it relates to children and blood levels. They can intervene and help their local communities and the residents in those to help reduce the vulnerable risks associated with lead. They can provide bridges to the healthcare profession for the utility profession. They can support proposals for funding, and when I think a healthcare provider comes in and really puts a measurement on why it's important to fund these programs, it really helps. So I wanted to provide some examples of water systems across the U.S. that are actually taking some steps towards full lead service line removal. So Middlesex Water, which is in New Jersey, serves a population of about 250,000 and have almost completely found all of their service lines or inventoried all their service lines for the utility portion that's owned. So in that graphic I showed earlier, that would be the left side of the service line that's underneath the street. So they estimate that they're at 93.5% complete in finding all of those, and now they're engaging in an effort to find all the lead service lines that are under the customer's property. So they think they're only at about 10% of that, but still this is a significant step forward because most utilities don't have inventories of where all the lead service lines are, and especially don't have good inventories as to where they are under the customer portion side. So Middlesex, in order to accomplish this, is working with state regulators to develop a funding method to pay for the replacements after they're found, and that should help the customers with financing of the challenge. Cincinnati has a GIS interface, and that's on their website for the utility, and the customers can log into that if they believe that they have lead service lines and get information about if they're at risk with lead service lines. Milwaukee, they face removing up to 70,000 lead service lines. Consequently, the City Council, the Health Department, and the Water Department have worked together to develop a multifaceted program. In December of 2016, a Milwaukee ordinance prohibited repairing of lead service lines and required full lead service line replacement. So that was passed, and the city has begun implementing that ordinance in January, the very next month of 2017. And then American Water, which is a privately owned, investor-owned water utility. I have on my slide, you'll see the note about them in the bottom left corner. They collectively, they are in 16 states, and if you add up all of their utilities, that makes them the largest utility in the U.S. They are identifying and replacing full lead service lines across their 1,600 systems in the U.S. So there's, I didn't touch on all of the examples here, but you can see from the graphic that there are great examples of utilities who are motivated to solve this problem, and as they do, others will learn from them and continue to help us remove the 6.1 million lead service lines. Let's move on to the next slide, please. So one of the biggest challenges, of course, is how does this get funded? And that is a huge challenge for lead service lines, their removal. Communities have lots of competing challenges for funding. Lead service lines definitely being one of them, but on the right-hand side, I sort of give you some estimate of all of the financial challenges that water and wastewater and stormwater utilities are facing. But as it relates to lead service lines, we have estimated that with $6.1 million and a cost of somewhere between $5,000 to $6,000 per lead service line removal, the new cost for lead service lines is somewhere between $30 to $50 billion in removal. So some creative financing is very helpful. Lead service line replacement, it takes place in the context of all of these other priorities, and so this is part of the mix of things that utilities are trying to face. And again, public health community can help provide context for lead service line replacement and for local elected officials and governing bodies, and collectively, I think we all have part of the solution for us. I'll give a couple examples of the people who've successfully done things. So in 2016, Wisconsin developed a 2-year-long program to assist in funding of full lead service line replacements. 2017, Virginia offered loan assistance to its customers to engage with the water system for full lead service line replacements. In 2016, the Massachusetts Water Resources Authority, which is the wholesaler to the Boston metro area, negotiated a $100 million interest-free loan, which is available to the cities and the towns that they serve who will help remove lead service lines. Denver Water has established a $1 million revolving loan fund to assist low-income households with full lead service line replacements. And then in Indiana, there is a statute that has been passed for establishing a process and a criteria for water systems to fund full lead service line replacements using revenue generated through their water rates, which is a unique approach to finding funds for lead service line replacement. Can we go to the next slide, please? We've talked about this just a little bit, so I won't spend a lot of time on it. But as water suppliers AWWA and our members, what we focus on is what we know, which is how is water provided to customers. And we know that there are other sources of lead, but we focus on what we know best. And we trust that the other professionals in the other areas will help to create this holistic approach to removal of lead in its entirety. But from our perspective, where we can help the most is in the area of municipal drinking water. So let's go to the next slide, and I'll talk a little bit about how we do that as well. So it was mentioned that AWWA has 43 chapters, and we have lots of conferences, and we do lots of webinars, and we do publications, advertisements. We're part of different groups. And so with the release of the Lead Service Line Replacement Collaborative website, AWWA has been using that website and our delivery channels through our chapters to build awareness and provide a stronger conversation around how does a utility actually implement these sorts of strategies to remove lead service lines. And our 43 sections are incorporating all of this information into what they do with their chapters and with their members so that we can have a stronger reach. And from our perspective, this is an effective way to get the information that we create at the collaborative or that AWWA's experts create, and then we can get it really into the hands of the local people to use it to get their solutions in place. Next slide, please. So I want to talk about how the collaborative has made lots of information available. And if you haven't been to the website for the collaborative, I recommend it because it has this fantastic roadmap on the steps that you should take in order if you want to start accelerating the removal of lead service lines. And at the same time, we are always looking to fill gaps and to find other ways to fully replace lead service lines in the best way possible. So one of our business partners is the Water Research Foundation, and they're leading a charge on how to replace lead service lines. They have a couple of current projects that are out there trying to provide better information to the utility community. One is on how to locate lead service lines without digging them up, and then also on strategies for flushing out your lead service lines. AWWA is an ANSI-approved standards writing organization. We are the only standard writing organization for drinking water in the U.S., and we have the standard, which is off to your right. You can see it on the graphic. It is out for public comment right now. The public comment period will end in about a week or so. It'll be the first of its kind standard that will help our utilities with concrete information on how to go about replacing and flushing lead service lines. So we think that's a strong addition to the body of knowledge for lead service lines. Next slide, please. Just some final advice for everyone, maybe just two things, which I have there. If you run into people who are having questions about water utilities and about whether they have lead in their water, our strongest recommendation is that you recommend that they call their local water utility, and that their water utility really ought to be the first stop. And if their water utility can't help them, then hopefully their water utility can refer them to someone else. And one of those, either for them or for you, could be the American Water Works Association, and we have our website is down at the bottom of this slide, and we'd be happy to help any of you or anyone else with solving lead service line challenges. And with that, I will turn it back to you, Dr. Neely.
David, can you hear me?
Yes, I can.
That was an excellent presentation. You brought up a really, very good point, and the point of the matter is that nobody disagrees on the science around lead. the issue always comes down to money. And one of the points that I just want to make is that in February 2010, the Pew Charitable Trust did an economic evaluation where they said, okay, it will cost somewhere between $1.2 and $11 billion to remove the lead from our society, and the benefit of prevention, that means children who do not get poisoned, is in the vicinity of $192 to $270 billion. So that's an argument that we often make when we go to legislature, because when you look at the effects on IQ, lifetime earnings, special cost for special ed, cost for treatment for attention deficit, hyperactivity disorder, behavioral problems, and then crime problems, and you wrap that all in, then it helps to frame, okay, here's the cost on paper, and here's the cost to society, and it's easier to see the benefits. So let's go to a couple of questions that we have here. So we've gotten a couple of questions about partials. Can you speak to the collaborative stance on the issue of partials, David?
Yeah, I can speak to it from AWWA's perspective, and then the AWWA's perspective and the collaboratives are the same. So if you think back to that graphic that I showed, where I showed the lead service line, and part of it was underneath the street and part of it was underneath the homeowner's property. A partial generally refers to the removal of the portion that is underneath the street and is owned by the public utility or the community water system. And that is a practice that's in place in many places, and it is part of operational procedures when a water utility is replacing the main down the street and they come across a lead service line, that they'll remove just that portion that they own and not remove the portion underneath the property owners. So the research says that that is not a smart practice in terms of protecting public health, and that our policy statement, AWWA's policy statement that our board approved, the recommendations of the lead service line removal collaborative, and in fact the NIDWAC, is that full lead service lines is the best way to protect, removal of full lead service lines, is the best way to protect the public's health. So our stance is that that is what utilities should do.
Because you're saying that by just removing the partial, you actually increase the amount of lead that goes through into that home by only taking a piece of it. Is that correct? Yeah,
with keeping it very simple. You know, as you cut that line, you then create greater risk than if you remove the line in its entirety.
Right. Okay. Another question is, what frontline communities do you have working with the collaborative? And we use an example of Milwaukee and Pittsburgh and Flint. Are there others?
Yeah, there's some. The first one that comes to mind for me is Denver Water is also there. They're there as part of AWWA, and they're part of the collaborative as just a utility on their own. But there are others in there, and part of the challenge to them, or the charge to them, is to work with the other associations, so American Water Works Association and another organization called AWWA. We all can connect to the water utilities.
Okay. There was another question. It was a statement that I made, but I'm going to put it to you because you're the water expert, that I said that the lead service lines are the primary source of lead in drinking water. And I had read somewhere, and I don't remember where, that it is as much as 70%. Can you comment on that?
I can't comment on the percentage, because I think that may have come from one of the Water Research Foundation research projects that they've done. But the idea that lead service lines are the primary cause is one that we would agree with. Now, having said that, I just make two other comments. One is that even with the removal of lead service lines, that does not create a lead-free risk removal, because in-home plumbing sometimes has lead in it. So there's still that risk. And then the other one, and I'm oftentimes concerned as I hear this. I still hear people who are in various aspects of the water business, not particularly water utilities, but who still think that the lead in water comes from the source water. So, for example, in Flint, the lead in water did not come from the Flint River. It came from the corrosion in the water that then came in contact with the lead service lines. So the source was the lead service lines.
That's an excellent point. And my understanding, can you explain the water mains that go down the middle of the street? They're not lead also. Is that true?
No, yeah, they're not made of lead.
Okay, great. Thank you. There's another question about what are thoughts for using point-of-use filtration as an interim prevention method?
Some communities are doing that. In Flint, they've issued point-of-use filtration, which is, for listeners who are unfamiliar with what that term might mean, it's basically you attach it to your faucet and it's a filter on your faucet. As an interim basis, if you have a concern, it is not a bad strategy to do that. And in fact, especially if it makes you feel more comfortable, it's probably a very wise strategy. Some words of caution. There is a filter in those point-of-use devices. Those filters need to be cleaned out on a regular basis. So if it's your long-term strategy, you need to change those filters. And one thing that just as a sort of daily reminder for everybody, for those of us who get water from our refrigerator, meaning that there's a little spigot where you just put the glass and it fills up, or you get ice that way, those filters also need to be replaced as well.
That's an excellent point, David. And also on that point, I want to mention that Milwaukee is actually giving these filtration point-of-use filtrations to pregnant women in the city of Milwaukee so that they are not exposed to the higher levels because to replace 70,000 lead service lines is going to take quite a while.
Yeah, the strategy sort of, maybe there's two things. The idea of using point-of-use devices is helpful in the interim while lead service lines are removed, but also it's important to make sure you get the right kinds of point-of-use devices. So you want to make sure that it's ones that are certified for lead removal.
Okay. Another question that I see is, are the costs to society of not eliminating lead that I mentioned documented anywhere that we can access? So what I mentioned is the Pew Charitable Trust. If you Google that, they did a report in February 2010. There's another report out of Michigan, and I could look that up if somebody wants that, and they could email me, and I could get that for them. And there's another question for you, David, is can we get a link to the draft, January 2017 replacement and flushing of LSLs of AWWA report?
So that was, I think, our standard. And if you go to awwa.org, which is our website, and you up in the right-hand side, you'll see a search. And if you do a search there, then you should be able to get it. And if for some reason you can't, my email address is right here on this page.
Okay, great. Let's see. Another question just popped up. Give me a minute here to for Zakia, here's a question. What efforts, if any, are happening to prevent exposures to lead from drinking water in Virginia and specifically Richmond, Virginia?
What efforts are happening to prevent
exposure to lead from drinking water in Virginia, specifically in Richmond, Virginia?
It would be all the work that we're doing at the collaborative, the Lead Service Line Replacement Collaborative. It would start with educating people. It would then be followed up with those full service line replacements, but letting people know that a source of water is a means that children can get poison, where we ordinarily think of just lead-based paint as being the primary source. So it starts with education, letting people know that water is a source of where children can get poison. and continuing on with the works of the Lead Service Line Replacement Collaborative.
Thank you, Zakia.
Mm-hmm.
David, a question that someone's asking, corrosion control, what does that mean, and does it create another potential source of hazards?
All right, so as a non-chemist, it's the addition of some chemicals at the water treatment plant that changes the acidity of or the pH of the water. It then, as the water goes into the lead service line, it does create a coating on the lead service line on the inside of it to protect, creating a barrier between the drinking water and the lead pipe, so that the drinking water doesn't come in contact with it, with the lead. Now, the barrier is not permanent, so it can come off, so it's not a complete solution, but it is the best solution in the interim while we're trying to remove those. I do not know of any other health effects associated with that, though. So on that part of the question, I'm not able to answer that.
I might take that one on. What I listened to when I listened to the testimony, I did hear an environmental group make the point that some of the corrosion control chemicals can add chemicals to the water supply that then go into the lakes and streams and increase algae blooms. So that's what I heard secondhand. Another question, how effective is flushing lines?
Research is still out on that. It'll be part of the Water Research Foundation's research studies that they're doing right now. But there's a lot of positive aspects that people promote, and a lot of concerns and risks that people promote as well associated with it. But the goal is to flush them out so that they're then clean. That is the objective.
I wonder if the person who's asking that question was also wondering if, by running the cold water for 5 minutes, that's a good way in the interim to not be exposed to the lead that could be sitting in the pipes overnight, for example.
Oh, well, thank you for asking that question as a follow-up, because my first answer had to do with if there was a partial removal and the idea of flushing at that point. So the idea of running the water before you start drinking it in the morning after the water's been sitting is not a bad idea. The issue is you want to then run that water long enough so that you're actually pulling water from the main as opposed to pulling water that's been sitting in your service line. So you want to run it for a few minutes. The length of time would be a function of how far away you are from the main, but the idea is to try and get the freshest water you can.
Good point. And if I live in an apartment house, I'm on the 5th floor, I should run it a little bit longer.
That could be.
Yeah.
Or
okay,
drink
so what is
water.
Another question, what's the cost range to replace one lead service line?
I think Zakia talked about, in the sample she had, that it was about a day's work for the utility to replace one, and I've heard estimates that are about that, sometimes a little bit less, sometimes a little bit more, depending on the complexity of it. And we bracket it at about somewhere between $5,000 per service line to about maybe $8,000. But sometimes you hear people talking about 10. But we would sort of, as a global estimate, say 5 to 8.
Okay. Let's see. I'm looking through some more questions. What is being accomplished from a public health perspective by Tacoma, Washington, by removing lead goosenecks? And tell us what a lead gooseneck is.
So a gooseneck it's called that because of the shape of the lead pipe, and that is where it's connecting to the main on the water system. And let me see. Give me 1 second.
While you're looking that up, there's another question that says, are the lead service lines mostly in private homes or any in multifamily housing? I'm going to tell you that the line goes to multifamily housing too.
Yeah, it does go to multifamily home. So the work in Tacoma I don't have all the details on it. It's on my slide that I showed everyone about the local communities are taking the next steps. So simply finding the goosenecks is helpful for knowing where lead service lines might be in the system is all I could probably comment on at this point.
Okay. Here's another question. What about the larger community feeder line that supply the neighborhood and individual service line? Given what was said about taking out the lead service line, will utility water do free water testing? And what testing should be done, water versus blood or both?
Okay, so there's a lot of components to that question.
There's a lot of questions there.
But so the first, I think taking it as I remember from the top of the question, so the big pipes that leave the treatment plant that come to your neighborhood are not generally made of lead. So the material that makes them is generally not lead. So that's, in fact, I could probably remove the word generally. And so that part's easy. And then different utilities have different policies as it relates to providing testing of the water in your home and whether it's free or not. So I would recommend that people call their utility or maybe start just by going online, seeing if they have a program that they've published online for testing the water in the home. If they do, that's a great source. I did it with my home. I called my utility, and they had a program where they would come out and test your water, so I did it just to make sure. I was pretty certain that I did not have a lead service line, but that is the best way to check. If you're not certain, is to test the water. It's not a perfect way, but it's probably the best way to give yourself a peace of mind. And if your utility isn't providing that, they could probably recommend someone who can.
Correct. You could also call your public health department because they may be able to give you resources in your community where you could have it tested for free. If we're in Wisconsin, you can have it done at the State Lab of Hygiene. So I'd say call your public health department too. And the second part of the question I'll take, what's the testing that should be done, water versus blood or both? Well, as we said, everything is about preventing children and anyone from being lead poisoned. Test the water first. I would much rather find it in the water, do something about it, than find it in the blood. Once it's in the blood, it's in the blood. You really can't do much about that. It's done the damage. Let's see. Is there a link to the U.S. map that showed the number of lead service lines in each state, David?
Again, that map comes from the study that I referenced. So if you go to awwa.org, we have a page which focuses on lead, and you should be able to find the study from which we took that map.
Great.
And I think all you have to do really, if you go to that page, it's right on the page. The study's right there on the page.
And then here's another question. It says, is the data on national lead service line distribution an aggregation of data from the EPA or from other sources?
I'm not sure I fully understand the question.
I'll try it again. It says, the data on the national lead service line distribution, does that come from the EPA or other sources? What's
so
the source of that
if
data?
that's referencing the graphic that I had,
right.
That would also be from the study that I just mentioned.
Okay.
So it's the AWWA 2015 funded study.
Okay, good. Let's see. Looks like we got to most of the questions, and it looks like we're ending right about on time. It's 11:20. Well, it's 11:27 here in California, but. And I'd like to thank both of you. It's been very informative. I learned a lot about this myself, and I'm going to have Lindsay wrap it up.